So good afternoon. First of all, thanking patient and patient attenders for giving the permission to do this video. And first of all, thankful. And now we'll discuss the case of generalized Anasarca. So he is a 45-year male patient. He presented to hospital with complaining of generalized body swelling, that is generalized Anasarca, since 15 days. That swelling is increased progressively since 1 month. Now since 2 days he was having dyspnea. So he came to complaining of complaining only breathlessness and generalized anasarca, and he was unable to sleep. That is, he is having PND, that is paroxysmal nocturnal dyspnea. With orthopnea he is having, and he is having mild cough also. So with this complaint he presented in hospital. So this is a very important case, that what we have to find the causes of the generalized anasarca. So anasarca may seen in any conditions. So what you have to do is, in which conditions patient will get anasarca. So he presented only with this complaint. It may be because of the respiratory condition, it may be because of cardiac, it may be because of the low anemic status, that is because of the cardiac failure condition, it may be because of the thyroid disorders, hypothyroidism will cause generalized edema, and next is it may be because of the any protein losing nephropathies, protein losing enteropathies, that is protein losing enteropathies, and it may be because less protein intake, it may be because any other causes, it may be if it is only a specific part, it may be because of the cellulitis. If it is, just think that the edema only to this limb, it may be because of the joint disorders, that is arthritis will cause only joint edema, or it may be because of the DVT, cellulitis. There are n number of causes. So he came to casualty with generalized anasarca. Our job is to rule out the causes of anasarca. So what are the causes of anasarca and how to evaluate the anasarca? From head to toe, we have to do examination. General examination will give the clues to diagnosis. So only what you have to examine is, first we will examine for the pallor, because pallor will give the diagnosis towards the anemia, and anemia will give diagnosis towards the what you call generalized anasarca. So only thing is, every anemia will give generalized anasarca? No, not every anemia will give generalized anasarca. Anemia that is less than 6 or less than 5, that too in chronic anemia, because of the chronic anemia conditions, chronic low anemic conditions. So in this condition, the patient may have cardiac failure conditions. Because of the chronic anemia, patient that heart is unable to, because of the heart will loss his left ventricular resection factor. So LV failure will occur. Because of this condition, he may develop the generalized edema. So this is because of anemia. So we look towards the anemic. Examination will do later, and we will case discussion I will do. First, anemia. Anemia will cause, because of the low HB, it may cause some problem. And next comes the thyroid disorder. So what are the thyroid disorder will cause anasarca? Even that hypothyroidism condition will cause anasarca. How the hypothyroidism will cause anasarca, and how to differentiate between that anasarca secondary to hypothyroidism or anasarca secondary to any other causes. So if it is an anasarca that is non-pitting, you just think that if the pedal edema, you can see here, this pedal edema, you can see if you press here, it will clearly show that some pitting. So this pitting type of anasarca, that is what you call pitting type of edema, it's never be because of the hypothyroidism, because hypothyroidism condition, it will cause the non-pitting type of edema. So this is also one of the clues to diagnosis. And one more thing is, what are the lungs causes? We can see there are some lung causes which will cause generalized edema or the bilateral pedal edema. What are the lungs causes? That is only one lung causes, that is cor pulmonale. What is meant by cor pulmonale? Cor pulmonale living better right heart failure, because of the chronic lung disease, that is because it may be because of COPD, it may be because of chronic asthma. In this patient, because of their chronic lung conditions, the patient may develop some heart failure conditions. This is called an cor pulmonale. In this patient, because of the right heart failure, patient is right ventricle is unable to pump. Because of the unable to pump, it will goes towards the negative pressure towards the superior and inferior vena cava. Because of the backflow condition, patient may develop some pedal edema, some increased jugular venous pressure with ascites or hepatic tenderness, it may be developed. So this is one of the lung condition. Next goes towards the heart. So heart conditions which will cause anasarca is most commonly it is a CCF, that is conjunctive cardiac failure. So because of the CCF condition, what is meant by CCF conjunctive cardiac failure means, there will be, because of any other causes, heart is unable to pump. So it is pumping capacity reduced. If the pumping capacity, there is left ventricular pumping capacity reduced, means because of the low ejection factor, patient will develop negative pressure towards he may develop pulmonary edema, he may develop generalized body anasarca, and this is because of the heart condition. So ejection, I will do investigation later. So you can anemia we have done with the thyroid disorder, and we have done with the lung causes, that is core pulmonale, and we gone with the what you call cardiac condition, that is congestive cardiac failure. So these are the very common disorders, and some other disorders which will cause and generalized anasarca is simple. Patient will have less protein intake, that 2 years together. If any patient he come to casualty, he is lean by build and he come to casualty with generalized anasarca, we have to think out whether he is maybe protein intake may be less, because of this condition may be chronic anemia, because of the chronic less protein, so it may be because developed the anemia. So what are doing? What is protein? So protein is a very important. So what it does is simple. Only one simple I will tell. Protein will helps to hold the fluid in the vessels. So if the patient is having low protein, though there will be a loss of vessels. The patient, because of the low protein, there will be and edema will develop, because inside the vessels the fluid will go outside the vessel. Whatever the fluid inside the vessel, that all goes outside the vessel because of the albumin. Albumin, that is protein. Protein will hold the fluid inside the vessels. If the patient of any hypoalbuminemia or hypoproteinemia, they may have developed the anasarca or edema. So in this patient, one thing is next course. If you think about intestine, so what are the causes of intestine to develop anasarca? So there are some disorder called any patient of malabsorption disorders after the any gastrojejunostomy, any operation, they may have less protein malabsorption. That's why they may develop some pedal edema or any generalized anasarca. And some condition called irritable bowel syndrome, IBS, anything, they will have some protein losing enteropathy. So these disorders are broadly classified into protein losing enteropathy. And one next, this may cause an anasarca. And the only important is kidney. So kidney is very important in patient of acute kidney injury, in patient of chronic kidney injury, or some nephrotic syndrome, glomerulonephritis. This all will gives the generalized anasarca. And there are some conditions called protein losing nephropathies condition. Those also, because of low protein, they may develop this anasarca. One important thing is liver. So in patient of alcoholic patient, they will make cirrhosis of liver. They may cause because of the less protein, they may cause ascites, pedal edema, and JVP, everything. So these are the one. Now we'll go towards the examination. By first you can see that by clinically, first head to toe I have to examination how to do. You can see the configuration. So you can see here anemia is that much anemia is not there. Nalgi tigiri. Mild pale tongue is there. Nalgi ಮೇಲೆ ಬಸ್ರಿ. There is no any typical suggestive of full pallor is not there, and we can see finger also, nails also. So there is no any typical pallors now, and we can skip now. HB maybe like we have to send for the hemoglobin count to see the HB. And next one thing is I have to auscultate the lungs. Akad nodri, usradri. Jor. Okay. So his air entry is bilateral equal, and he is not having any wheezing and COPD feature. His only thing is he is having lower zones, he is having crepitations. So it may be because of the lower zone crepitations. It means it may be because of the that is called as pulmonary edema conditions. That may be because of the congestive cardiac failure. We will next see towards the JVP. You can clearly see this. See, you can see this JVP. Raised, he is having, you can see this. He is having this much raised JVP. I have not pressed any liver also. That is hepatojugular reflexes. Only by seeing only you can see this much of the huge JVP you can appreciate here. And next thing is he is having JVP is there. And abdomen I am seeing. ಸ್ವಲ್ಪ ಕಾಲ್ ಮಾಡಿಸ್ರಿ, ಇದು ಕಾಲ್ ಮಾಡಿಸ್ರಿ. So you can see this subcutaneous some edema also there. Not only ascites, you can see the subcutaneous edema also there. So it's a purely no certainly. Okay. All subcutaneous edema is there. You can see here also he is having edema. So that's why you can see pedal edema. Okay. So he is having generalized Anasarca. So what you have to do, how to diagnose, like what are the investigations to send for this to rule out the anemia Anasarca is, first you have to send the HB to rule out the anemic condition that causes Anasarca, and you have to send the TFT. TFT will diagnose the hypothyroidism Anasarca, and you have to take a chest X-ray to rule out any cardiomegaly, and if it is a cardiomegaly, increased JVP, bilateral pedal edema, and mild ascites with hepatic tenderness, it directly goes towards the conjunctive cardiac failure. And one more is systolic murmurs you have to see. You can see here. Yes, he is having mild systolic murmur is there. So it may be because of the conjunctive cardiac failure, because his output everything is okay, and only thing is he is having JVP. And next, to rule out core pulmonary, you have to take X-ray also. So X-ray shows up COPD changes. And next thing is you have to send the serum albumin to rule out the hypoalbuminemia. If it is there, means it may be a low protein that will cause an Anasarca. And only thing is you have to go ECG you have to take to rule out any cardiac disorders, X-ray to rule out pulmonary edema, cardiac failure, and COPD, any other conditions, TFT to rule out that, and HB to rule out the anemic conditions. So these are the basic investigations. If it is the only joint edema, if that is, it may be because of single leg edema, it may be because of cellulitis, DVT, arthritis, and that to be ruled out. And we took then some investigation. So his investigation shows that HB is 8.6. This 8.6 HB will never cause this much Anasarca. And one more thing is WBC, everything is normal. Creatinine is 1.1. That is kidney part is normal. He is not in acute kidney injury, chronic kidney injury, and total bilirubin is 1.7. That is also quite normal. He is not having jaundice, and there is no any ascites condition. There is no any hepatomegaly to rule out that causes. It may be because purely this is a case of CCF, because we have to advise the echo, and echo also done. So it shows up. You can see the reduced LV function, left ventricular function. Only ejection factor is 30%. You can diagnose only by this also. So 30% ejection factor with LV failure with IHD is there. Because of all these conditions, we directly diagnose towards the conjunctive cardiac failure. So this is the way to diagnose, the way to evaluate the Anasarca patient. So one important and rare condition is, if you not found any other causes, there are some disorder called vitamin D deficiency, that is in the brain. There is a very danger. I will discuss in the next session. So this is the evaluation towards the Anasarca. Thank you.